Most of the time, thigh pain is nothing to be alarmed about. It's typically caused by muscle bruises and strains. Most of the time, thigh pain subsides with time and rest. You may be able to speed things up, though, by doing the following. Placing ice on the inside of your thigh to reduce pain and swelling. Do this for 30 minutes every 3 to 4 hours for 2 to 3 days, or until the pain is gone. Compressing your inner thigh using an elastic bandage or tape. Taking non-steroidal anti-inflammatory drugs like ibuprofen and naproxen to reduce pain and swelling. Be aware, though, that such drugs can have side effects, and they should be used as recommended by your doctor. Doing stretching and strengthening exercises as recommended by your doctor or a professional physical therapist. Resting the injured thigh muscles as much as possible. Keep in mind that there are some causes of thigh pain that can be dangerous or even life-threatening, so it's never a bad idea to check with your medical provider if you suddenly start feeling thigh pain for no apparent reason, like an obvious injury. These conditions include, but are not limited to, the following. Nerve damage may cause tingling, numbness, or a burning pain in the outer part of your thigh. This typically occurs on one side of the body and is caused by compression of the nerve. A blood clot could cause pain, swelling, tenderness, a warm sensation, and a pale or bluish discoloration. Diabetic neuropathy, a complication of diabetes, results from uncontrolled high blood sugar levels. Discomfort usually starts in the hands or feet, but it can spread to other parts of the body. The purpose of this video has been to provide quick, basic answers to the question, how do you relieve thigh pain? For additional information, see links to related resources below the video screen. But remember, you should always rely only on a doctor to diagnose any symptoms you may be experiencing.